Bismillahirrahmanirrahim. This video will summarize the regulation of blood glucose. The fasting blood glucose level is 80 to 90 milligram per 100 ml, and after 1 hour of the meal it becomes 120 to 140 milligram per 100 ml of the blood. It returns to the normal within 2 hours after meal due to activation of feedback mechanism, and this high glucose after meal stimulates insulin secretion that promote uptake, storage and usage of the glucose, bringing level back to the normal. And low glucose in fasting and starvation will result in glucagon secretion, and this activate gluconeogenesis and glycogenolysis in the liver and maintain glucose supply. During starvation, gluconeogenesis, that is the glucose formation from non-carbohydrate source, is critical for maintaining the fasting blood sugar level, ensuring energy for the brain and other glucose-dependent tissues. So, liver act as a glucose buffer. After a meal, insulin stimulates the liver to store up to two-thirds of the absorbed glucose as glycogen. As blood glucose or insulin level fall between meal, the liver releases stored glucose back into the blood. Thus, buffering action reduces fluctuations in the blood glucose by about two-thirds. In severe liver disease, uh, maintaining a stable blood glucose level becomes very difficult. Insulin and glucagon also act as a feedback regulator. High blood glucose will lead to insulin secretion, increased insulin secretion, and then the glucose level drops toward the normal, while the low blood glucose will lead to increased glucagon secretion that will now uh, increases the glucose release from the liver by glycogenolysis or gluconeogenesis. Insulin regulation is usually more dominant, but glucagon becomes crucial during starvation and intense exercise or stressful conditions. Then sympathetic nervous system in the hypoglycemia also regulate the blood glucose. In severe hypoglycemia, the hypothalamic activation is there and activation of sympathetic nervous system. So adrenal uh, epinephrine will stimulate the liver glucose release, protecting against dangerous low blood glucose. Then there is long-term hormonal response. During prolonged hypoglycemia, growth hormone and cortisol are secreted. These hormone reduces glucose utilization by cell and increase fat metabolism, conserving blood glucose for vital organs such as brain. So it is important to maintain the stable blood glucose because certain tissues rely almost exclusively on glucose for energy, including brain, retina, germinal epithelium of gonads. The gluconeogenesis during fasting primarily supports brain metabolism. Pancreatic insulin secretion is suppressed during fasting to ensure that the limited glucose is preserved for the brain and not consumed by muscle or peripheral tissue. Why this blood glucose should not be too high because of the osmotic effect. A high blood glucose level increases osmotic pressure in the extracellular fluid, leading to dehydration of the cell, and also there is good effect that is termed as glucosuria or loss of glucose in the urine. When blood glucose level exceeds the renal threshold, that is about 180 milligram per deciliter, glucose spills into the urine. Then there is osmotic diuresis. The glucose in the urine causes excessive water and electrolyte loss, leading to dehydration and electrolyte imbalance. Then there is long-term vascular damage. So chronic hyperglycemia, as happens in uncontrolled diabetes mellitus, damages blood vessels causing increased risks of heart attack, stroke, end-stage kidney disease, and blindness. So maintaining blood glucose within a narrow range of 80 to 120 milligram per deciliter is critical not only for providing energy to the glucose dependent organs but also for preventing both acute and chronic complications. Thank you for watching this video. If you have any query, please write in the comment box.